Let's discuss face reading dysmenorrhea. Dysmenorrhea is classified into two types, primary and secondary. Primary dysmenorrhea is not an organic disease but recurrent menstrual pain, while secondary dysmenorrhea is caused by an organic disease of the pelvic cavity, such as endometriosis. Dysmenorrhea is a condition characterized by recurrent abdominal cramps or distension during the menstrual cycle. Sometimes symptoms such as breast swelling, nausea, and cold limbs can also appear. Primary dysmenorrhea is a result of the obstruction of uterine blood flow leading to insufficient blood or oxygen supply to the muscle tissue of the uterus. Secondary dysmenorrhea is the result of gynecological condition, tumors, or repeated early termination of a pregnancy. Face reading. Traditional Chinese medicine believes that dysmenorrhea results from cold and blood stasis in the body or a deficiency of blood and essence. Manifestation on the tongue include pale tongue with teeth impression or cracks on the tongue with little or no tongue coating, and there are petechiae on the edge or tip of the tongue or stasis of collaterals on the underside of the tongue. In young women, telangiectasia in the triangular fossa zone of the ear, skin spots or small patches with red tinge on the genital zone of the ear, or little dots with red tinge on the endocrine zone of the ear. So here is the illustration of the skin spots or small patches with the red tinge in the ear. Therapeutic methods. Dysmenorrhea not only affects the patient's daily life, but may also trigger other ailments. Measures should be taken to prevent and take care of it. During dysmenorrhea, drink warm water with brown sugar, which helps dispel cold to alleviate pain. Dietary advice: avoid eating raw, cold, pungent, fatty, and greasy foods during menstruation. Avoid drinking strong tea, coffee, and liquor. A week before menstruation, you should have a diet that is light and nutritious. Lifestyle: make sure you stay warm during menstruation. You can put a hot water plunge at your lower abdomen and lower back to dispel cold and relieve pain. Rest during menstruation. Avoid taxing the mind, avoid severe stress, maintain a peaceful state of mind, and avoid overexertion that can cause both physical and mental stress. Medicinal diet therapy: dried orange peel and red dates tea. Dried orange peel 5 grams, 2 red dates. Wash the dried orange peel and red dates, put them in an earthenware pot, add water and bring to boil on high temperature, then simmer for 20 minutes on low heat. Drinking it while it is warm. This tea is good for patients with dysmenorrhea because it works to invigorate qi and replenish the spleen, tone qi and replenish blood, and some ginger to the tea to dispel cold. Moxibustion for those with insufficient menstrual blood. Apply moxibustion to the 1 point to replenish essence and blood, to the Hegu and Sun Jin Yao points to promote qi and blood, promote blood circulation, and relieve pain, and to Shish Shu point to relax muscles and clear collaterals, soothe menstruation, and alleviate pain. Apply mild, warm moxibustion to these points for about 15 minutes each, once daily. Thank you for your attention.
Interviewing: emotions and mental state. And mental state. Chinese medicine defines 7 primary emotions that each have their own specific qi dynamics. These qi dynamics will resonate with whilst affecting the various Zhengfu organs. This means that the emotions are etiological factors as well as being manifestations of imbalances in specific organs. that Chinese medicine only defines 7 emotions can sound slightly simplistic. These 7 emotions should, though, be perceived of as being primary emotions in the same way that there are only 3 primary colors. The various combinations of the 3 primary colors can manifest as the infinite myriad of colors that we can see with our eyes. In the same way, all the emotions we experience contain varying elements and combinations of these 7 primary emotions. The specific chi dynamic of the various emotions are described in the fundamentals of acupuncture, Ching 2016. Inquiring about a person's emotional life can give an indication of the state of the various Zangfu organs, as well as possibly revealing relevant etiology. It is, though, important to be conscious of a person's boundaries and to exhibit tact when inquiring about a person's emotional universe. Furthermore, we must also be conscious of our therapeutic limitations. We are practitioners of Chinese medicine and not trained counselors. That said, although we ask about the emotions from a dynamic perspective, we will often affect the emotions therapeutically by our treatment of the organs involved. For example, by treating acupuncture points such as liver 2 and pericardium 6. We harmonize the liver, drain the heat from the liver and heart, and help to get the qi flowing freely. This will affect the mood of a person with liver and heart qi stagnation, who is irritable, short-tempered, and impatient. It will often result in them acting and reacting differently in situations that previously resulted in conflict, which thereby increase their levels of liver qi stagnation, thus breaking a vicious circle. Sure, conditions in an organ will often manifest with a certain emotion being dominant or difficult to control, such as anger when there's liver fire. A deficiency condition or a stagnation of an organ's chi can result in a person having difficulty manifesting certain emotions. Generally, I tend not to ask directly about the 7 emotions, but instead, I inquire about various mental and emotional aspects of a person's life, and in this way, get a sense of how the 7 emotions are manifesting. The emotional aspects that I personally inquire most often about are first, worry, speculation, and obsessive thinking. Anger, irritability, quicker temper, and impatience. Third would be mood swings. Fourth, depression. Fifth, anxiety. Sixth, the ability to say no and set boundaries and assertiveness. Furthermore, I ask about their memory, ability to concentrate, mental restlessness, and brain fog. A person with spleen chi deficiency or dampness will often express that they have a tendency to worry a lot or that they speculate about things, pondering and thinking in circles. They will have difficulty letting go of thoughts again. Due to the weakness of their spleen, they will have difficulty digesting information and transforming this information into knowledge. This will be reflected in the fact that they have to rerun the information through their head repeatedly in an attempt to extract what is relevant and useful. Thank you for your attention.
Let's now discuss Truth 2 or Crook Fund of the Hanyang large intestine meridian. LI11, Truth 2, is at the lateral aspect of the elbow at the end of the lateral transverse crease. LI11 is the earth point, the tonification point, the hussy point, and one of the 13 ghost points, and one of Madame Yang's 12 points shining bright as the starry sky. An extremely useful point, it regulates nutritive qi and blood and is an excellent tonifying point, not as powerful as stomach 36, which is another hussy point of the Yangming, but invigorating and grounding for a metal if undernourished or too up in the clouds. It reestablishes the mother-child connection along the Shang cycle and so provides stability. It can bring a sense of harvest to large intestine. When large intestine is deficient, someone can feel disconnected from heavenly chi and as though there is never enough for them. They can feel deprived and try to hoard things, food, books, memories to suppress the feeling of lost value and emptiness of purpose. The movement of metal is to return to the interior. But when this movement is compressed by disappointment, chi deficiency, or grief, it can fail to initiate any approach to others, becoming alienated and defensively isolated. The movement of Earth from the center outward, its impulse in health to include and support, can supply large intestine with a sense of belonging in the world and a freeing of tension. As the mother element of Earth, as the mother element Earth can support the larger intestine in its work, the final stages of processing or refining choices about what to value and what to discard. Li11 influences both the interior and exterior. It regulates the Li channel, particularly the shoulder, elbow, and forearm when there is muscular tension or D syndrome or after wind stroke. It does not have a much effect on the face as Li4. They may be used together to affect all areas from the shoulders up. The abundance of qi and blood in the yangming helps nourish the muscles and sinews. Li11 is useful when there is stagnation in the stomach and large intestine or the yangming meridians. General abdominal pain or constipation or diarrhea, especially when there is heat involved, might draw you to choose this point. The yangming is rich in qi and blood and tends towards overheating. Heat in the blood disrupts the tranquility of the heart and shen and can lead to mania. This accounts for the crook pond's inclusion as a ghost point. Crook pond pools blood heat and can be used when there is heat in the blood affecting the skin, as in some types of psoriasis. Li11 is frequently combined with Li4 and Du14 in acute fever and situations of fire poison, boils, throat swelling with heat. It can help clear interior heat from any organ. Being a Hussey point, it allows qi to drain from the meridians into the organs. Hussey points can be used to supplement or tonify or drain and disperse qi, expels exterior wind, and is often used in later stages of wind heat and resolves dampness and is useful for resolving damp heat. Used for masses in the back and upper body. It's also used for thyroid, goiter, and consider this a form of phlegm. It benefits the sinews and joints, and as a Hussey points are used to smooth the flow of qi and blood in the meridian, as well as the sludge pain and pathogens in the joints, and so are good for joint pain. Li11 is indicated for weakness and instability in the large intestine, where there is no sense of harvest. It is also for hypertension from liver fire, for skin eruptions from damp heat, and for lower jaw problems of damp heat, cystitis, digestive problems. It is also for eczema, psoriasis caused by heat in the blood, and for problems in the forearm, elbow, and shoulder. This point is the mental precision point. This valuable tonification point can strongly invigorate the meridian. It can be considered for problems in the face, example, eye disorders, especially when accompanied by extreme redness and pain, for earache, for toothache, along with Li4 and Li7, for bronchitis and hay fever. This point may be effective in cases of chronic constipation. It's excellent for bringing stability to the large intestine. Its earth point, it is the earth point. Consider this point before releasing the internal dragons if a degree of possession is suspected. It is a ghost point. It is for problems of the shoulders, upper arm, and forearm. Thank you for your attention.
Let's discuss heart pattern, heart-yang deficiency. Deficiency of heart-yang develops from deficiency of heart qi and the appearance of deficient cold pattern. Clinical manifestation, palpitations, chest distress or chest pain, chilly with cold limbs, shortness of breath, lassitude, spontaneous sweating, pale complexion, a pale and moist tongue body with white tongue coating, faint, knotted, and intermittent pulse or deep wake and slow pulse. Analysis symptoms are always secondary to the deficiency of heart qi. Key symptoms, palpitations, chest distress or chest pain, and general symptoms of yang deficiency. So for the analysis of deficiency of heart-yang, deficiency of heart-yang, deficiency of heart, so there's palpitation, depression of thoracic yang, cold, coagulation due to yang deficiency, blockage of the channels and collaterals, chest distress or chest pain. Deficiency of heart chi, lacks of support of heart spirit, there's shortness of breath, lassitude. Yang deficiency, deficiency of warmth, so there is chilling with cold limbs, pale complexion. For failure of defensive function, there is spontaneous sweating. For disturbance in water metabolism, there's pale and moist tongue body, white tongue coating. Failure to pulsate due to yang deficiency, faint pulse or not dead, and intermittent pulse or deep, slow, and weak pulse. Heart-yang deficiency etiology, repressed emotion, chronic illness, blood loss, excessive sexual activity, retention of dampness, overwork, old age. Underlying or accompanying pathology, kidney yang deficiency, heart chi deficiency, heart blood deficiency. Signs and symptoms, palpitations, breathlessness on exertion, feeling of oppression, possibly pain in the chest, worse from exertion, feeling of cold hands and feet, fatigue, slight depression, spontaneous sweating, bright pale face, slightly dark lips. Pulse, deep and weak. If severe, it may be knotted. Tongue, pale and soft or pale green blue. Treatment principle is to warm and supplement heart yang, shen, supplement kidneys to support heart. Acupuncture treatment, heart 5 supplements heart chi, bladder 15 supplements heart yang with moxa, ren 6 supplements yang of whole body, ren 14 clears the heart, stabilizes shen, heart 7 quiets the heart and shen, pericardium 6 supplements heart chi, ren 17 unbinds the chest, do 14 supplements the yang, do 4 secures essence, regulates chi. Needle with supplementation and moxa. For blood stasis, we use bladder 17, liver 3, spleen 6, needle with Eden method. Relevant advice, it is important that yang is protected and not further burdened when there is heart-yang deficiency. This means that the patient should avoid consuming food and beverages that have a cold energy or temperature. At the same time, they must not overexert themselves and men should avoid having too much sex. Heart-yang can be damaged by excessive sweating, therefore sauna and steam baths are something that is not recommended for these patients. Thank you for your attention.
Pulse taking, we discussed tympanic pulse or leather drum skin pulse. This pulse is superficial, requiring touching only, very large and hollow but hard. It is so named because palpating it resembles touching a drum. Clinical significance. A tympanic pulse indicates blood loss or spermatorrhea. It usually occurs in a patient over the middle age, most commonly in an illness of deficiency and exhaustion. Other conditions causing partial fullness of the vessels include bleeding, such as hemorrhage during labor, or moderately severe fluid loss. These conditions can all show a tympanic pulse. The processes that produce a tympanic pulse are the same as those that produce the hollow pulse. Deficiency of yin blood with floating of yang qi to the exterior. The tympanic pulse and the hollow pulse are both floating and hollow. The chief difference between them is the degree of hardness of the vessel. The tympanic pulse is forceful as though feeling a drum, indicating that the vessel is relatively hard. The hollow pulse is forceless as though pressing on the stalk of scallion, indicating that the vessel is relatively soft. When a pulse feels wiry, almost rapid, and without substance in its center, it is leathery. It is like hitting a drum skin. It feels firm and impatient under light pressure, but hollow under heavier pressure. It is a combination of the hollow and wiry pulses. In any disease with internal deficiency of Jing blood and cold perverse Qi, the leathery pulse can be felt. In females, it can occur when miscarriage causes continuous uterine bleeding. In males, it can occur after emissions cause deficiency and damage of Ying Qi. Tympanic pulse is superficial, large, hollow, but hard. This indicates floating of Yang Qi due to yin blood insufficiency. Clinical significance, blood loss, spermaturia, usually patients over the middle age with deficiency and exhaustion of yin blood. Thank you for listening.
Let's now proceed to liver qi stagnation heat as we continue our discussion on diagnosis according to Zhangfu organ patterns. Liver qi stagnation heat occurs when stagnant liver qi start to generate heat in the liver. The etiology here is the same as that of the liver qi stagnation. Drinking alcohol and eating spicy food, fried food, and food that is warming in its energy can be contributing factors. The symptoms and signs are the same as those seen in liver qi stagnation, with the difference that there will be also heat signs. For example, thirst, dark urine, a red face, and restlessness. Several of the symptoms and signs described for liver qi stagnation will be more pronounced. For liver qi stagnation can result in a person internalizing their emotion. A person with liver qi stagnation heat will be more irascible and irritable and have a quick temper. The heat will often result in them being impatient. Their face may be red. The sides of the tongue will be red, or there will be red speckles on the sides. The key symptoms, these are the same for liver qi stagnation, plus red sides of the tongue, thirst, a quick temper, and irritability. For the treatment principle, we spread liver qi, drain heat from the liver. The acupuncture points to choose from are liver 2, liver 3, liver 13, liver 14, bladder 18, gallbladder 34, LI4, and pericardium 6, and we use the draining needle technique. Further explain the choice of points. Liver 2 drains heat from the liver and spreads liver qi. Liver 3, particularly in combination with LI4, spreads liver qi in general. Liver 13 spreads liver qi in the middle jiao, especially when it invades the spleen. Liver 14 spreads liver qi in the middle jiao, especially when it invades the stomach or when the qi stagnates in the upper jiao. Gallbladder 34 spreads liver qi, especially when it affects the muscles and tendons. Bladder 18 spreads liver qi and clears heat from the liver, and pericardium 6 pumps the shen and spreads liver qi, especially in the middle and upper jiao. The advice that was given for liver qi stagnation is applicable here, as well as advising the client to avoid foods and beverages that have a warming energy, especially alcohol. Liver qi stagnation heat can be caused by liver qi stagnation, and in turn can result to liver qi invading the spleen, liver qi invading the stomach, liver yin deficiency, liver blood stagnation, liver fire, heart qi stagnation, stagnation of qi in the upper jiao, and phlegm. To summarize, liver qi stagnation turning into heat has its etiology in states of resentment, frustration, and anger over long period of time. The underlying or accompanying pathology are stagnation of liver qi and hyperactive liver yang. The signs and symptoms, hypochondrial or epigastric distension, feeling of oppression of the chest, irritability, melancholy, depression, moodiness, premenstrual tension, irregular periods, premenstrual breast distension, lump stone throat, feeling of heat, red face, thirst, and easily angered, and heavy periods. The pulse will be wiry and may be rapid. The tongue is red on the sides. The treatment principle, force the liver, rectify qi, resolve depression, harmonize liver and spleen and stomach, and cool heat. The acupuncture treatment, pericardium 6 to regulate liver qi. liver 13 to harmonize liver and spleen, liver 3 to course the liver chi, liver 2 to clear heat from the liver, gallbladder 34 to course liver chi, liver 14 to harmonize the liver and the stomach, Sanjiao 6 to clear heat in the three burners, bladder 18 to disperse liver stasis. Thank you for your attention.
Let's talk about tongue coating, inspection of tongue coating thickness and tongue coating moisture. Coating texture. This refers to how thick the coating is and what other characteristics it has, such as moisture, greasiness, curd, quality, or exfoliation. Thickness, if the tongue body can be seen through the coating of the tongue is thin. Otherwise, it is thick. The thickness of the coating reflects the depth of the location of illness and the strength of the pathogenic evil in the body. A thin coating suggests illness in the exterior or mild illness in the interior. It indicates that genuine qi has not been injured and evil qi is not strong. A thick coating suggests a more severe illness and a deeper location of illness. It indicates phlegm accumulation or retention of undigested food so that turbidity containing stomach qi rises to the surface of the tongue. Thickening of a thin coating suggests worsening of the illness, whereas thinning of a thick coating indicates that the genuine qi is subduing the evil. Here, in the photograph, we see one tongue that has no coating, while the other suggests it has a coating, and the other is a bit moist. Moisture. A normal tongue coating is moderately moist and neither slick nor rough. It reflects normal flow of body fluids that have been damaged. A coating is slick if saliva is excessive and about to drool. Such a slick coating suggests exogenous cold or dampness or accumulation of dampness and phlegm made possible by deficient yang not being able to rise upward. A dry coating, whether dry and rough or dry and coarse to the touch, reflects fluid damage by excessive heat. It usually occurs when deficiency of yin fluid or accumulation of dampness obstructs yang qi, so that qi cannot generate fluid. A coating that is hard, tough, and patchy suggests blazing fire and severe damage to fluids with consequent failure to keep the coating moistened. The dry or moistening of the tongue coating reflects declining or rising amounts of fluids. A moist coating turning dry means that heat is strengthening and fluids are being damaged. A dry coating turning moist means that heat is weakening and fluids are recovering. So here in the photo, the first one we see very dry. So there is heat accumulation and there is thickening of the tongue coating, while the second, there is a greasy coating on the tongue. Thank you for your attention.
Epigastric pain due to stasis of blood in the stomach. Clinical manifestations, stabbing epigastric pain, which is worse with pressure and after eating, palpable masses in the epigastrium, vomiting of dark blood, sometimes looking like coffee grounds, dark complexion. The pain may be worse at night. There may be blood in the stools. Tongue, purple, possibly only in the center. Pulse is choppy, wiry, or firm. This can only be a very chronic condition that takes a long time to develop. Stasis of blood usually derives from stagnation of qi over a long period of time. Stasis of blood in the stomach is often associated with stasis of liver blood. It may also be the result of other stomach patterns, principally stomach fire, stomach cold, or retention of food in the stomach. A stabbing type of pain is typical of stasis of blood, and so it's possible aggravation at night. Because this is an excess condition, the pain is worse with pressure and after eating. Because the stomach is related to the large intestine, the bright yang, the stasis of blood may extend to the latter organ and cause blood in the stools. This blood would be dark, reflecting stasis of blood. The purple color of the tongue body indicates stasis of blood. It may be purple only in the center. The tongue will be reddish purple if the blood stasis is associated with heat, and bluish purple if associated with cold. As this is a very chronic condition, it is inevitably accompanied by other patterns, such as stasis of liver blood, stagnation of liver qi, retention of cold, patterns of excess type, or deficiency of qi or yin, patterns of the deficiency type. Carcinoma of the stomach often manifests itself with this pattern. Treatment principle: invigorate blood, eliminate stasis, harmonize the stomach, stop pain. Points: Ren 10, stomach 22, 34, spleen 10, bladder 17, spleen 4, P6, bladder 18. We use reducing or even method. Ren 10 stimulates the descending of stomach qi. Stomach 22 restores the descending of stomach qi and dissolves accumulations in the epigastrium. Stomach 34, which is an accumulation point or qi cleft point, stops the pain and moves qi and blood. Spleen 10 and bladder 17 invigorate blood and eliminate stasis. Spleen 4 and pericardium 6 in combination open the penetrating vessel or chongmai and remove obstructions from the epigastrium. The penetrating vessel is the sea of blood because it controls all the blood connecting channels. Its opening points can therefore also be used to invigorate blood and eliminate stasis. Bladder 18 is used if there is stasis of liver blood. The patient should be advised to avoid eating late at night and eating too fast. Thank you for your attention.